But now I would like to welcome Dr. Mara Beverage. She's in our Department of Dermatology, a senior attending physician, and she and I trained both at the same time in Chicago, although we didn't know each other in Chicago. But yeah, so I have that connection with Dr. Beverage. So Dr. Beverage, please.
Thanks for that welcome. I'm a dermatologist at University Hospitals. I see patients at main campus and in Beechwood and Solon. And so I'm going to be talking to you about dermatologic surveillance. So the role of the dermatologist, as you've heard, advanced stage melanoma, the treatments are getting better, but they are still not curative. If we can't catch melanoma early, and the vast majority of melanomas start on the skin and are visible, so if we can catch them early, the treatment is much better, much more curable, much easier. All right, so today I'm going to be talking about the role of the dermatologist, signs to look for melanoma on the skin, and then melanoma risk factors and prevention. All right, so you're a dermatologist, you're coming for routine skin checks. We're going to be looking at your skin, and the interval is typically every 3 to 12 months. If you've had melanoma or you're high risk for melanoma, you don't want to be going more than 1 year without seeing a dermatologist. And sometimes we see people more frequently, and that depends on the stage of your melanoma, how far you are from your melanoma diagnosis, and again, other risk factors, like how many moles do you have, how much sun damage do you have, what's your family history. So you and your dermatologist will decide that one together. At those skin checks, you're looking for if your melanoma has come back, if your melanoma has spread. Sometimes the signs of that are visible on the skin. You're looking for a second primary melanoma. People who have already been diagnosed with melanoma are at higher risk for another melanoma. And people who have already been diagnosed with melanoma are at higher risk for another skin cancer. A lot of the risk factors that put you at high risk for melanoma put you at high risk for other skin cancers as well. I also find for my advanced stage melanoma patients, as you've been hearing with a lot of these newer therapies that we have and the toxicities or the side effects that you can get from them, actually the number one side effect affects the skin. So checking with your dermatologist regularly can help you manage those side effects and maybe even prevent some of them. So I spend a lot of my visits talking about that and helping patients with that as well. And then education. What are you looking for? How do you help yourself? How do you help your family? So early detection. I have had some patients flat out ask me this, why am I seeing you? I'm getting scans. My scans will find the melanoma. I don't need to see you, which I thought was a great question. Your scans are really good at detecting advanced stage melanoma, but usually the melanoma has to be about 1 centimeter in size for the scan to effectively pick it up. If your melanoma is going to start on the skin, I can catch it when it's much smaller, when it's about 1 millimeter in size. So again, trying to catch that early stage melanoma, that's why you want your dermatologist to be part of your team as well. How are we going to catch it? You do want to try to find a board certified dermatologist. So there are a lot of dermatology practices that to increase access, physicians, assistants seeing patients as well. If you're high risk for melanoma, you want to see a board certified dermatologist. So this is someone who's gone through medical school, they've gone through a certified dermatology training program, and they've passed their boards. The American Academy of Dermatology. The American Academy of Dermatology, that's a great resource. That's a dermatologist professional organization, and they have a tool on their website to find a dermatologist. That can help you check and make sure that you've found a dermatologist who's highly trained and well-trained to help you with what you need. That dermatologist should be using a dermatoscope. A dermatoscope, actually the newer ones, they've, with a lot of technology, about a lot of powerful technology in a small looking thing. I think a lot of my patients just think I'm using a flashlight. It's more than that. There's a filter in there. It polarizes the light, which actually lets me see through the first layer of the skin, the epidermis, even into the top layer of the second layer of the skin, the dermis. And that's where most of our pigment cells for our moles and our melanoma live. So I can actually get a pretty good idea of what that mole is looking like just with this light. And then photography. I have tools to take photography in the office, so I will use that to monitor certain patterns that I think need a little bit of a closer eye. But there are also tools for you to use yourself at home. Go in your app store, there are a lot of different apps to do. This is the one that I tend to plug, OHSU. It's Oregon Health Sciences University. They've made a pretty good mole mapping app. It is free. Unfortunately, it's only available for iOS, which is why I have the Apple Store logo on there. But it's free. They ask you to participate in research. So the photos that you upload, they might use that for research. It's de-identified. They explain it very well. You don't have to participate in research to use the app. You can also use it without doing that. And it's just an additional tool. The app is not going to tell you that something looks like melanoma, but it's a way for you to help track your moles. And then patients always have their phones in the office. So then if I have a patient who's using this app, I can use it too. And if we're unsure if a mole is new or changing, we can kind of look at that together if I haven't already taken a picture of it. All right, so what are the signs? What are we looking for on the skin? Simply put, you're looking for the ugly duckling and the old friend that's changing on you. Popular TV show Friends, and then over time they change. I mean, I think they changed pretty well, but that's simply put what you're looking for. So if there's a spot on your skin that just doesn't look like anything else on your skin, either because it's darker, it's larger, the border, the size, or if there's a spot you know you've had for years and years, and all of a sudden that one's changing. It's growing, the color is different, the border is different, something about it is different. These are the technical and the technical kind of criteria that you're looking for. So the mnemonic is the ABCDEs of melanoma. A stands for asymmetry. So as you can see in that A picture, the right half looks darker than the left half. B is border. That one, when you try to draw your finger around it, you find your fingers kind of going in and out. That's an irregular border. C stands for color. There are about 4 shades of brown in there. So if you can't quite detect that, you kind of start with one shade and then you kind of go through and see, and yeah, they're like about 4 shades of brown there. That's too many. 1 or 2 shades of brown is fine. More than that is not good. D is diameter, greater than 6 millimeters, or the top of a pencil eraser. If you don't have pencils in your house anymore, I say the top of a quick point pen. And then E is evolving, something that's changing. Tricky part about this is these rules apply to moles and melanoma. Not every spot on your skin is a mole. There are other types of skin growths as well. But, that's why you need a dermatologist to help you with this. And together you'll figure out which ones are worrisome signs and changes, which ones are normal ones. I always tell my patients, it took me 3 years of intensive training to learn all of this. It will take you a few visits. I do find that most of my patients, after a few visits, start to get the hang of it and feel more comfortable. And I say you only have to learn one, so that makes it a little easier. All right, these are the friendly moles, the friendly patterns that are fine. The most common ones are brown, pink, and two-toned. So again, 2 shades of brown are fine, but as you see in these two-toned moles, it's pretty symmetrical, right? The one on the left is darker in the middle, lighter at the outside. The one on the right is a little bit lighter in the middle, darker on the 2 shades are fine as long as they're still fairly symmetrical. The eclipse and the targetoid or cockade are what we'll call the fried egg pattern. Those are also pretty normal patterns as well, but not as common. And then this is what I'm looking at with my dermatoscope. So this is the level of detail that I can see. And so these are some of the patterns that I'm looking for. You're not going to be able to see them, but I can. The one on the left, that reticulated pattern, that's my favorite. Reticulated or lace-like, that's a nice stable pattern. That's the way the melanocyte, the pigment cells look when they're sitting in the proper part of the skin. This middle pattern, the globular pattern, that's a sign that it's growing. That might be okay, and it all depends. So if I see that middle pattern, that globular pattern in a child, you can see those globules are nicely distributed around the This is normal for a kid. Their moles are still developing, they're still appearing. I'm perfectly okay with this. If I see that exact same pattern in a 70-year-old, I'm much more concerned. They shouldn't be having moles that are growing or changing. I'm much more likely to remove that one. And then this mixed pattern is mixed. This is one that often takes the most conversation because I just can't tell. You can kind of see here, there's some areas where they're globules, there's some areas where it's reticulated, there's some areas where the pigment just seems to be fading and smudging out. That's a pattern where I don't know immediately by looking at it, and either time will tell, so we take a photograph and we monitor it closely, or we just remove it and take it off to find out under the microscope. And that's why I need my dermatopathologist to help see a better detail after we've removed it. All right, so melanoma risk factors and prevention. So we've heard a lot about risk factors, and here's another slide, but the way I think about it is, unfortunately, a lot of the risk factors are things outside of your control. The biggest thing that increases your risk is what runs in the family. So on the left side here, hereditary melanoma, there are these genetic syndromes or gene mutations that can run in the family. Fortunately, they're incredibly rare, but if they do, you and your family are at really high risk for melanoma. And that's why to try to screen for that, we asked, does anyone in your family, have they ever had melanoma? We use that as a marker to see who's at high risk. The number of moles that someone has, that's another risk factor. The way I think about that one is when your body is just making extra pigment and extra moles, if that process goes wrong, then that's melanoma. So people whose bodies just naturally make more moles are at higher risk for having a mistake happen that could turn into melanoma. And then the last one, even though it looks like it's the smallest, it's kind of has the smallest increase in risk for the individual person. This group, this is what causes most of the melanomas that we see. And these are what we'd say are the preventable melanomas. So it's all the sunburns, the sun damage. And so this is why we talk about it so much. It causes most of the melanomas that we see. And it's the one thing that you have a little bit of control over. So how can you help yourself? Sun protection tools, sunscreen is the one that's been talked about the most, but it's not your only tool. But if you are, for sunscreen, you got to make sure you know what you're looking for. Unfortunately, most of the sunscreens on the market have these things. The days where I know you used to go and it'd be like an SPF 8, can't buy that anymore. Don't buy that. It's got to be SPF 30 or higher. You want it to say that it's a spectrum, which means it's causing both UVA and UVB, which are the types of sunlight that cause most of the skin cancers. And it is helpful if it says that it's water resistant. It'll just help if you're sweating or if it's rubbing, kind of help keep that sunscreen in place. 1 ounce of sunscreen or enough to fill a shot glass is what you need to cover the whole body. And you do want to kind of keep like every 2 hours in your mind. So if you're going out again more than 2 hours later, you should be putting another layer on. If you think you're going to be out for more than 2 hours, you should be bringing some with you to reapply. That's really hard to keep up with. So I am a big fan of the sun protective clothing on the right side of the screen there. Hats, long sleeves, long pants. And so they're more and more out there and they're becoming more and more comfortable. I always tell my patients, if you tried it before, but it's been a few years, please give it another try again. And then where to look for them. Hats, I think, are really tricky. It's very, very personal what hat looks good and feels comfortable on what person. So I say, just look anywhere. Sometimes it's the gas station, Target, like a museum gift shop. Like I have heard patients find their favorite hat at the most random places. So whenever you see a hat stand, just take a look and see if you see a hat that you like. You do want it to be a wide brim. A baseball cap is shielding your eyes. It is not the best sun protection. It's better than nothing. But when you see those baseball players and they've got that tan line or that's showing you where they're getting the best protection, which is really just shielding their eyes. It's not shielding your lower face, your neck, and the back of your neck. The sun protective clothing. So all clothing is a little bit sun protective. The benefit of something that's labeled sun protective, it's lightweight and breathable, but it's as sun protective as a heavier fabric. So if you think about linen, linen's a nice lightweight fabric, but if you hold it up to the light, you can see that light streaming right through it. It's not very sun protective. If you think about your thicker cotton jeans, unless they're really worn out, you hold those up to the light, no light's getting through it. So the jeans are really sun protected, but they're hot and hard to wear on a hot day. So a sun protective clothing should feel light like linen, but protect you like your jeans. Coolie Bar is a good company. That's all they do. They make sun protective clothing. That's it. And the outdoor clothing companies do a really good job now of making nice, comfortable sun protective clothing. So Columbia, REI, Patagonia, Land's End, those are the places where I tend to steer people to look for these things. And start just by buying one, see how you like it, see what you like, what you don't like, and just slowly keep trying to improve your wardrobe. In addition to skin checks, you want to make sure you're seeing your dentist regularly. It's rare, but you can get melanoma in the mouth, and the dentist can see that the best. Regular eye exams, likewise, it's rare, but you can get melanoma in the back of the eye. So a dilated exam with an eye doctor. Regular gyne exams. And for women who are not seeing a gynecologist regularly because they're too young or too old, your dermatologist can often do those exams as well. And we do recommend that all first-degree relatives see a dermatologist for a skin cancer screen. So that would mean, so if someone's been diagnosed with melanoma, their first-degree relatives would be their siblings, their children, and their parents if they're still alive. So in summary, follow regularly with your dermatologist. Your dermatologist is a helpful member of your team. Use your sun protection. Again, most of why you had melanoma was outside of your control, but we want to try to do everything that we can. And the sun protection is kind of the one risk factor that we can control a little bit. So every little bit helps. And if you see something, make a note. We're holding on questions.